I'm a GP in Bristol, and I've been working as an academic. So I'm a clinical reader up at Barts in the London been working there since 2011. I've been, I guess I started with the complexity and messiness of practice, which was a real shock to me coming into general practice, having wanted to be an orthopedic surgeon originally. But then I became fascinated by it and how we might educate for it. And so part of that journey was, as an academic, bringing creative inquiry, and that is exploring our lived experiences through the arts into medical education. I've been doing that since about 2003. To help students think about practice and talk about those things that often don't get voiced in medical education. You know, what do you do if a patient cries, or how do you continue to witness suffering? Those sorts of things. How do you be present to patients? And latterly, I've sort of realized that as students explored the human dimension of medicine and the patient, their own lived experiences through that creative inquiry process. So as they made art and wrote poems, and they shared in a safe small group space, they started to share something of themselves as well, and discovered flourishing, really, that actually sharing some and creating meaning together and sharing lived experiences as well as the challenges led to students feeling in these small groups like a community. So this is a student selected component I've run for like 15 years. And they would talk differently to each other and bring more of themselves to the space. So for the last few years, I've been exploring flourishing as well through creative inquiry, through various funding bids. And I'm now working one day a week across the whole of Queen Mary University of London as a flourishing fellow, and trying to find out co-creatively what it means to flourish. But actually flourishing is not really articulated yet. It's being increasingly used, but there's not a clear sort of definition of what it is. So I'm sort of excited at a grassroots level to be thinking about it, and I have some thoughts. But part of all of this is about moving the conversation from resilience and toughing it out towards something more ecological, more about meaning making, more drawing on Aristotle's eudaimonia, which is around meaningful and purposeful engagement in practice, more seasonal. So if I just stop and ask you the question, and I pose this to students as well, what do you think when I say, are you resilient? And how is that different to if I ask you, are you flourishing? And just to pause on that for a minute and think about what emerges. So resilience has been the sort of key message across all of this COVID pandemic. It's all over medical education literature, is you need to be resilient, and how can we make students resilient? And that is that sort of toughing it out on your own. And students are still being given these resiliency questionnaires, you know, and you go through and it's like, I can bounce back from absolutely anything because I'm so strong and brave and tough. But I often use my birch tree out in the garden there that I can see in the different seasons. And I think we can be flourishing with no leaves. We can be flourishing in full leaf, but it's more about, you know, it allows us to think about the sun that we're receiving, the rain, the soil that we're growing on, the different kind of soils and the different traumatic and otherwise paths that we've come through. It allows us to think about the sort of connections between, you know, nature in the garden, between each other. So it's more about something interconnected. And when students witness each other's challenges and the whole imposter syndrome, without having changed anything, run more, you know, eat better, all of those stuff, they actually start to flourish and feel better, and it all feels normalized. So yes, I'm basically working on what flourishing looks like and how can we support flourishing. And there's some of the sort of themes I've mentioned is the seasonal, ecological, interconnected, around meaning making, about compassion and self-compassion. But what you don't see in most of the other flourishing literature that's out there, or talk about flourishing, is around the keeping it real and the shadow work. So the sharing of the challenges and how important that is to flourishing as well. I'll leave it there.